clean up your adductor strength with my favorite adductor strengthening exercises. Yeah! All right, so adductor exercises are gonna be very important for a variety of different pathologies you see as a physical therapist. A few to come to mind are gonna be adductor strains, adductor tendinopathies, femoroacetabular impingement syndrome, athletic pubalgia, hip dysplasia. There's a myriad of them. So it's really important that we know how to choose the right exercises for our patients, starting with easier exercises and ramping up over the course of time. So in today's video, I'm gonna show you my favorite exercises, where to start, and how to advance over time. What's going on, guys? This is Dan from Fitness Pain Free. I'm a physical therapist and a coach. We've helped to make thousands of incredible clinicians for online courses, communities, and mentoring programs. The goal of today's video, to make you 1% better. All right, we're gonna start with the easiest of easy exercises, starting with isometrics. So essentially, we just have Joe here on his back, 9-degree bend at the knees. From here, takes the ball, puts it between his knees. Go ahead and give that a little bit of squeeze for me, and then relax. These are helpful for folks that have a lot of irritability, but do keep in mind, you can have Joe here push at 100% of his max or 20% of his max, right? So if you give them a really high intensity isometric, it might be too much early on. You can dose the amount of stress, the adductors, just by starting at a lower percentage and then working your way up, right? And I usually either do pulses, so basically squeezing it for 1 or 2 seconds and then relaxing and repeating for reps, so maybe 8 to 10, or I have folks hold it somewhere between 20 and 40 seconds. This is a rep range has typically been studied in tendinopathies, so sometimes I'll use that for folks like that, okay? The next exercise is going to be a ball squeeze with a glute bridge. So go ahead and give me a squeeze and go ahead and lift up those hips in the air and then right back down again. So we're basically getting the adductors firing while we work the hip extensors. Again, this is a very low level exercise. This is not something I do with an advanced athlete, okay? Once your athlete's tolerating these well, I typically go onto the side, right? And you can actually perform the same exercise. So you can do your ball squeezes in this position. What I like to do is start to incorporate the side of the hip a little bit. Let's go into a half side plank position. We're on your forearm, yep, hips in the air. From here, go ahead and squeeze that ball and then relax. Let's do a few repetitions. And one of the reasons why I like this position is because eventually we're gonna do Copenhagen Planks. And this is kind of like an easier variation of a Copenhagen Plank. And once your athlete is tolerating this really well, we can move on to those variants. Next, we have the classic Sidelying Adduction. I don't want to say it's a bad exercise, but it's such a short range of motion. I typically don't use this for very long. So once a patient can tolerate these well, I'm moving on, right? Even from the get-go if they can. So essentially, to perform this, we have Joe on his side. I usually put an Eric's pad underneath the hip. This serves 2 purposes. So for one, it's going to cushion his hip a little bit so he's nice and comfy. He can probably fall asleep right now, he's so comfortable. The second piece is that it drops him into horizontal abduction, so increases the range of motion of the exercise. So from here, we start with the knee bent. This shortens the moment arm a little bit, makes it a little bit easier on the adductors. Go ahead and lift that leg up into the air for me, and then right back down again. So if your athlete is tolerating this really well, not painful, too easy, we can just straighten out the leg here. Yep, and show me a couple repetitions. In this position, we have a longer moment arm, so the exercise gets a little bit harder. And then lastly, if we want to be real mean, we can just take a ball, put it on the ankle or an ankle weight, and go ahead and lift up towards the ceiling for me. Yep, just making this more and more challenging. But again, usually this is a pretty remedial exercise because there's such a short range of motion and not very functional. All right, next we'll get into some cable and band exercises. My personal preference is use a cable because it gives you more consistent pressure throughout the entirety of the movement. We're just showing you here with the band because it's a little tougher to set up in the cable stack, right? So essentially we have Joe sitting here, and then from here he has the cable or band attached to an ankle cuff that's gonna go around his knee. If this starts to fall off, we can take this and bring it above the knee here. But essentially he's gonna be on his toe on the right side. He's gonna go into abduction and back into adduction, back and forth, right? So this is very similar to an adductor machine at the gym. If you have access to this, I think that you would probably just use that instead. But if you don't have an adductor machine, you can usually just get away with using a band or a cable, right? You can also do this movement standing. In terms of where we keep the band, if we start with the band around the ankle, it's gonna be a little harder. We take the band and put it around the knee, it's gonna be a little bit easier because it changes the moment arm. Shortening out that moment arm makes it a little bit easier. So show me a few repetitions here where we're going into abduction and then coming across the body. Yep, and one of the things I like to do for my athletes is that instead of ending with your leg next to the body, let's have you come across your body. So cross over your foot, yep, then come right back again. Yep, and if it feels better, you can also step. So put some weight down on your foot as you step out wide, and then coming across and step again. Yep, back and forth. So you're getting a lot of work for the adductors there. Pretty good exercise.
Hey there, Broseph McJoseph. I hope you like treats. Evidence-based treats, that is. It's an evidence-based cheat sheet for diagnosing and treating femoral acetabular impingement. Now, not everybody loves searing hip pain right through the front of the hip as much as I do. And if you want to make any money as a physical therapist, you're going to have to help patients with this type of hip pain. Trouble is, gotta stay up to date on this condition to know how to treat it properly. And that's where I come in. With this handy dandy little cheat sheet, we'll catch you up to date on the medical literature on femoral acetabular impingement syndrome in under 10 minutes. We go over a lot of good stuff. Definitions, prevalence, incidence, population, anatomy, risk factors, pathophysiology, mechanism of injury, clinical examination, differential diagnosis, and treatments like physical therapy, injections, and surgery. Best of all, this is a free download. I'll leave a link in the description. Go ahead and download it and get your learn on. And now back to this video.
We can also work the adductors in supine. So essentially Joe is on his back here. The cable is going to be around his knee. He's going to have his knees bent to 90 and heels together. Arms are out wide to stabilize the body. Let that cable pull you out all the way. Rotate out wide and then pull that knee back to the other side knee. Yep, and let's just repeat for a couple reps. Another good variation you can try. It's nice and stable. You can load up on those adductors. Okay, next we'll talk about Copenhagen Planks. You can relax for now, Joe. So the reason why the Copenhagen Plank is a little further into the video is because I feel like it's fairly advanced. And if you have someone who has a really aggravated adductor tendinopathy or some other sort of surgery, we're definitely not starting here, right? So maybe start with some of those exercise variations we talked about previously, work up that capacity. Once athletes are feeling pretty good, then we'll try out the Copenhagen Plank, right? So to start in the Copenhagen Plank, you usually like to use a shorter lever, and essentially, the more you bring your hips to the bench, easier it gets, and the further away from the bench, it makes it harder and harder. So let's have you go ahead and set up here, Joe. And a few things you'll notice. So A, his hip is really close to the bench. We're gonna start off making this easier. The second piece is I put a few Airx pads underneath this bench here. So if needed, Joe can take his bottom side leg and support himself a little bit, right? And that makes it a bit easier. In terms of technique, Joe looks pretty good. Wanna make sure that the shoulders are stacked on top of one another, hips are stacked on top of one another. I think taking this arm and put it on the hip also stacks up the body a little bit better. That actually looks really good, right? All right, so say your athlete is dominating short lever Copenhagen planks with a little bit of assistance. The next step is to bring that knee in the hold that for 20, 40 seconds. As this is getting easier, we're gonna start to move further and further out, Joe. So you show me just a hold where you start to move out a little further. Very good. And as you get far enough out, we're gonna have to straighten out that top side leg. So let's walk out a little further. And from here, it's pretty dang hard. His leg is straight. As needed, we can also use the bottom side leg for support. Once your isometrics are feeling pretty good, we can move on to isotonics. So essentially, we're just adding motion, right? So we're gonna set up in this short lever position. And from here, yep, drop the hip all the way down to the ground and come all the way up in the air. Yep. Want to make this harder? Obviously, I can just extend out the moment arm. So essentially have Joe creep out a little bit further. Yep, you want to show a few repetitions there. Good, all the way up, all the way back down again. Good, take a breather. Let's go back to that short lever position. Now we'll add a weight. So essentially you just take a dumbbell and you put it on the side of your hips. Go ahead and grab this, Joe. Yep, and place it on the side of the hip. Let's do a few repetitions there. Excellent, looks really good. Take a breather. We can also make this a little more challenging by elevating the stand side arm. And what that does is shifts more weight towards your lower half, makes it a little bit harder, right? You can do this in a variety of ways. So the first of which is going up onto the hand, right? Up, then all the way back down again, Joe. Yep, and try to keep the elbow locked out as you go, right? If you're an athlete that's having trouble with their shoulder, doesn't feel good to be on their hand with their wrist, maybe has some wrist pain, we can elevate this stand side arm with a box. And this is usually quite a bit more comfortable. It allows your athletes to get more adductor work here, right? Yep. Make sure you're pushing actively with that shoulder, dropping hip all the way down to the floor, all the way up in the air. Good job, Joe. Next, we do some closed chain adductor exercises in the 45-degree back extension machine. You can have Joe set up here. Yep, his bottom side leg is gonna be attached. His top side leg is free, right? And essentially, we wanna have good posture. So imagine you're staying nice and upright even though you're on your side. And we just hold this isometrically just like a Copenhagen plank. Want to make this a little more challenging, I just add a weight. Go ahead and hug that to the chest. Obviously, make this really, really heavy if you want to. Let's have you take that back here, Joe. Thank you. If we want to advance this, we just add repetitions. So essentially, we're doing a side bend. So go ahead and show me a few repetitions here. So as Joe's torso goes down to the floor, his trail side leg goes up to the ceiling, right? And as you get comfortable, you can go further and further as strength improves. If I want to make this a little more challenging, I'm not going to be mean to Joe. You just have him hold the weight while he's doing it, right? Nice and easy way to advance and load. While your patient's doing this exercise, you just slide in there, steal their phone, go to the Fitness Pain Free channel and just like every single video that you can as fast as possible because he's finishing up in like 30 seconds. Go, like. Nothing to keep in mind is that not all of your adductors just adduct. And what I mean is that certain muscles, namely the adductor magnus, help you to extend the hip. So if I'm trying to work the adductor magnus, the things like lunges, step-ups, squats are all going to target that. Adductor longus is another interesting muscle. So yes, it adducts the hip, but it also flexes the hip when we're in end range hip extension, and it extends the hip or an end range hip flexion. So if we're trying to work the adductor longus, we can do this with resisted hip flexion. We can also do things like deep squats because we're working the adductor in the bottom of the squat. All right, so now you know about some good hip adductor exercises. You may still want to have better hip flexors. And Joe over here has the most jacked hip flexors of any guy I know. And he made a video with me, which, is right there in the corner. Go ahead and click on that. And I'll see you in that video. We'll talk about getting jacked hip flexors.